next is Christy Huff.
Hi, everybody. Thanks for having me here. I am a cardiologist and I am director of Benzodiazepine Information Coalition. And I'm here today as a patient advocate. And particularly, I want you to hear the patient voice today because I think that's what's often missing from the benzodiazepine safety conversation. In 2018, I helped develop an online survey to capture the patient experience with benzodiazepines, particularly their withdrawal. And, most of the patients in our population are experiencing physical dependence and withdrawal effects and not necessarily addiction. But we had over 1,700 respondents, mainly from the online benzodiazepine support groups. Results are not yet published, but I would like to share a handful of the comments that we received from benzodiazepine survivors. I believe they are powerful. If I could think of the one worst possible thing you could do to a person, it would be benzo withdrawal. It beats cancer and Alzheimer's combined. It is important that we be believed when we report how horrific the symptoms are that we have experienced, and they can go on for many, many years. One of the most brutal aspects to my withdrawal experience is that I was not believed and even laughed at. I was constantly coming down with mystery illnesses from the drug, and these illnesses required additional medications to cover up the problems. Doctors never once acknowledged the pills could be the reason behind any of my issues. After 30 months of not taking benzodiazepines, one 10-year user said, "I'm still so violently ill, I'm bedridden most days with symptoms." And lastly, benzos have completely destroyed my life. Existence is beyond torture. I do not believe I will survive. While these comments are certainly shocking, I know that these patients are not exaggerating because I've had the same experience. In 2015, I was harmed by benzodiazepines. The words that describe my experience don't exist in the English language. Suffice to say, it was a torture beyond all imagination. And the worst thing is it went on for years. I don't have time today to tell you my full story, but I'll describe it in a nutshell. I developed physical dependence and severe interdose withdrawal simply from taking short-term low-dose alprazolam exactly as prescribed by my doctor. I switched over to diazepam to taper, and it took me over 3 years to come off. That was as fast as I was able to taper off the medication. During that time, I experienced multiple horrific withdrawal symptoms. I was completely disabled, unable to work or care for my child. Fortunately, my story ends well. I finished my taper. I'm now over 2 years benzodiazepine free. And while much better than I was during my taper days, I still do suffer symptoms of protracted benzodiazepine withdrawal. When my problems began with benzodiazepines, what was shocking to me is that I had difficulty finding a doctor to help me. The most help that I found with benzodiazepines was actually on the online support groups. There I met many other patients who had suffered effects from taking their medication simply as prescribed, yet they were still having adverse effects and prolonged and difficult withdrawals. These patients were turning to online support groups because they were having difficulty, like me, finding a doctor to diagnose and treat their problems. And is unfortunately, many times their only option for help and support. As I read more about the issues surrounding benzodiazepines, I was struck by the lack of training that I had received during both my medical school and my internal medicine residency, particularly about the length and severity of the benzodiazepine withdrawal syndrome and how to properly be prescribed a benzodiazepine. And as I talked with other patients on the forums, it became clear to me there's a general lack of knowledge in the medical community surrounding these drugs. And it's one of the main reasons I became involved in advocacy. So I just listed here on this slide some of the gaps that I perceive there to be in physician education. This is based on feedback that we receive quite frequently from patients that have been going through benzodiazepine withdrawal. But one of the major things is people are being taken off benzodiazepines either abruptly or tapered too quickly by their doctor. I'll just reiterate the need for a flexible, gradual taper plan for patients. Not everyone needs to take a long time to taper, but some patients are going to need months or years, like in my case. Often physicians are not recognizing the adverse effects, including tolerance, physical dependence, and withdrawal. And there's an overwhelming lack of informed consent, which is why I actually wrote that informed consent form that Steve had mentioned to you earlier. And lastly, there's little awareness of the protracted withdrawal syndrome. I will say I was very excited to see in the recent drug safety communication about the existence of protracted withdrawal syndrome. Next slide, please. Because up until now, patients, when they ever experienced it, have not been believed. Steve actually coined the term benzodiazepine injury syndrome, which I think is an apt description, because these symptoms are going on for years, and I think it's probably beyond what we would expect from withdrawal. I think these patients have experienced some type of neurological injury. Ashton's work describes about 10 to 15% of people experiencing a protracted course. And really, I just think it's the relentless nature of these symptoms plus lack of support and treatment increases risk of suicide in this population. So I'll just conclude by saying that I think the benzodiazepine injury syndrome or protracted withdrawal needs a lot more research. This is definitely a gap in our education. We need to know numbers affected, who is at risk, and how to treat and how we can support these patients as well. Again, thanks for having me here today.
Christy, thanks very much for sharing your experience and for the work that you're doing at the Coalition. We really appreciate having the perspective today.